So whatever medicine we give, ergotamine derivatives or vasograin, whatever we give, what it does, vasoconstriction. If you are getting more headache, what you do? Extracranial blood vessels, you do massage or tight something, vasoconstriction. If I can achieve the vasoconstriction by using some resonance, is it interesting? I'll teach you technique for achieving change in the blood circulation of your face, eyes by simply using a resonant sound. Resonant sound will induce a relaxation. Relaxation will change the blood circulation. Change the blood circulation. See the difference. You want to experiment? How many of you have headache? So let us experiment. There is one traditional asana called as Shakuntalasana. Shakuntalasana. Some of you are sitting in Shakuntalasana. I'll see. 1, 2. You come. Sit here. The way you are sitting, you can sit. The way you are sitting there. Huh? Please. It is fun. Shakuntala waiting for her husband Dushyanta Maharaj at the banks of a river. And when she starts, so it's my version to make a fun. When she starts waiting, she's sensory bombardment is very high. She's waiting. She's so much tired. Her neck muscles, scalene. Please come. Scalene sternocleidomastoid. You want to come? You are highly distracted. Come here. You come here. There is no bed. Otherwise, I used the bed. Please. That group is highly distracted group. That's what I catch. Sit. Hindi. Which language? Happy birthday, Okay. So yoga, simple yoga also I'll teach. I'll make it like a fun. Shakuntala asana. Asana is the Shakuntala asana, but I use it for headache technique. See the difference. Okay. Story wise, I'll tell you because we'll remember story. Our memory is basically audio, visual, and mixed. Is it not? You'll remember Bollywood songs with music, with visuals much more better than our study materials. Yes or no? So we'll use the same technique in our studies. You sit like this. Both hands. Now both hands. So now you do an anatomical analysis. This is a little uncomfortable for both of them. For him, it will be a little comfortable. You want to go to an extreme where you don't mind lying down like this? You want to lie down like this? Come. You can do it. Come. You can use that. Use that. Shakuntala is lying down. Come. You know the story, old story. अभी मजा आ रहा है लोग शूज निकाल हाँ फाइन या lie down comfortable definitely you'll feel some difference. Okay, now anatomically analyze this. The head weight, not that head weight, this head weight. What is the head weight? I don't know exactly, maybe around 8 kg. 1.6 kg brain skull. नहीं चलेगा इतना ही छोड़ ऐसे करो ये comfortable है हाँ ये this is comfortable. Okay, you would like to do on your lap? You can do on your lap. You can do like this, the way he is doing. Okay, close your eyes. So analyze it anatomically, the alignment of your neck, head. Do it, please do it. You do it. Your head weight is on your both palms, and that weight is transferred to the elbow. Do you agree with this? Okay. Look into his eyes. His eyes he has very good looking eyes. T4 check कर लेना एक बार. T4, T3, T4 check कर लेना. Because I want you to see his eyes, because I'll see the changes. I want 1 or 2 people to be witness from the same group. You want to come in the same distraction group, you come. इधर आ जाओ. आप आ जाओ. Come and see her eyes. उसके आंखों में आंखें डाल के देखो एक बार. इसके उसके नहीं. इसके. Look into her eyes. One of you can come, look into his eyes. Challenge is, when you do this resonance technique, definitely there will be some changes in the blood circulation of the eyes. So this is my challenge. Maybe it is my hypothesis. We are going to prove it, yes or no. Come and see his eyes. Come, please come. One who is, just come and see. See the difference. All you can look into each other's eyes. Now right away, look into each other's eyes. ऐसे मज़ा करने पे आपको मज़ा आएगा बोल के पता नहीं था, करेंगे हम लोग. ओके, उतना ज़्यादा भी नहीं, ठीक है, बस है, बस. ओके, होल्ड ऑन. So now, so technique is, I want to block the external visuals. So 80% of visuals come from eyes. For your cerebellum, 80% of information, I don't know, just exactly find out. Majority of the information comes from your eyes and semicircular canals. Okay. With your index finger, close your ear. The tragus part, close your ear with your index finger. Okay. Close your eyes with your little finger. If you can do it this way. Yeah. Close it fully. Okay. So you do this way. Let me also sit. I am one of them. So one of you can look into my eyes. Okay, you sit like this. Shakuntala Asana. I want to close my, you can experience, close your ear with your index finger, tragus. Close your little finger, close your eyes with your little finger. Okay. Take a deep breath in. While breathing out, notice that very interesting fact. All the breathing in is sympathetic dominance. All the breathing out is parasympathetic. Majority of the yoga people, when they teach you any chanting, anything, it is an extended exhalation. Is it not? So see the difference when you do. I want to use the resonance of sound, which is vibrating more at the level of my vocal cords and the head and neck. So close. You are looking into my eyes. See that? Okay. Close your eyes little gently with your little finger. Close your ears with your index finger. Take a deep breath in. Keep observing me. Breathing in. Breathing in. Breathing in. One more last time. Breathing in. Very slowly and gently, I open my eyes. Any change in my eyes? Reddish. Yes or no? You acknowledge? Did you notice before and after? Yeah. Look into his eyes. Did you do the technique? Bas. Any change in his eyes? More red. यहाँ पे बोल दो. It's my clip. So this technique, when more red, do you see any change in your eyes? So what I can claim is, the blood circulation of his face increases. Done. Thank you very much. You can go back. So this is the best style. When you are back into your room, you can try this technique. My claim is, you can go. Thank you. My claim is, if you can try 20 counts of this resonance technique with the Shakuntalasana, you have not heard of this asana anytime, is it not? Shakuntalasana, we have not heard of it. So it's like there are 84 lakhs of asanas, 630 skeletal muscles, 230 joints, and 206 bones, is it not? So I use some technique of permutation combination and I design the technique. So this technique is, I call this as a Shakuntala asana with these two tragus. Close your ear with your index finger, close your eyes with your little finger. Make a resonant sound. Breathing in, breathing out, make more of a sound where there is a more vocal plus head and neck. So this resonance will increase your facial blood supply and indirectly cause relief in your headache. Will you be able to do? You want to ask some questions, you can ask, otherwise you can wind up. You can ask some questions. I'll teach which will be useful for you. So this headache special technique, there is one more called as Pashu Vishramasana, which I use for relieving back pain. We don't use our interscapular area much. I use some technique to work on the interscapular area. If you would like, I can teach. Or you can ask me some questions, I can teach. It seems to be more distracted, or you need a more relaxation. What breakfast you had 2 days before? Is it the same regime? Then you will be able to remember. If you are not, then your brain will, other part of your brain will be activated when you are sleeping, and it will clean all the information from the short term memory. What is your date of birth? You will be able to remember, is it not? So majority of Indian textbooks follows the technique of SQR3 technique. You are aware of this? Survey question, read, recall and revise. SRRR. So survey is, you do the general scanning with your whatever text you have, whatever chapter you have, you do the routine scanning, just like how you see the newspaper, you just go through the headlines. Take time 1 to 2 minutes, go through the headlines, 1 or 2 minutes, survey. Then usually the textbook have, at the back of your textbook have easy versions like long questions, short questions, fill in the blanks and all those. Just go through that once. So it will give you a registration to the brain that it is important topic, not to be forgotten as that of a short term memory. So survey question, then read. So did you anytime check what is your reading speed?